Good morning and welcome to Senator John Arch, legislative candidate from District 14. Thank you, Senator Arch, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and joining me today are AARP lead advocacy volunteers Susan DeCamp, Danny DeLong, Tim Potter, and Mike Barwig. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. Senator Arch, we appreciate your taking the next 30 minutes of your time to meet and discuss issues of importance to the 50-plus voter and their families in your district and across Nebraska. As a short background, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering and strengthening people 50 and older to choose how they live as they age. As people live longer, healthier lives, we know we need to think differently about what it means to age. So with that, Senator Arch, if you want to take the next 5 minutes and give us a little background about yourself and your campaign, that would be great. And then once you've completed your opening, we'll move into the questions. So with that, I'll give it back to you, Senator.
Sure. Thank you. Well, thanks for the opportunity to talk to all of you. So I have now served 4 years in the legislature. I served the first 2 years as vice chair of Health and Human Service Committee. And now I am chair of the Health and Human Services Committee for the last 2 years. I have resided in this district for over 30 years. And both of my kids were raised here, went to public schools in Papillion and La Vista. And my wife of 44 years continues to teach as a substitute teacher in the Papillion La Vista schools. My background was healthcare. And I served as most recently as the CEO of Boys Town National Research Hospital. I have worked for Boys Town for over 27 years on the healthcare side of Boys Town, and continue to work there, doing some consulting as well as some leadership development for Boys Town. So I am particularly passionate about some of the questions that you've asked here about healthcare and long-term care. And some of those, that's obviously something that appears before the Health and Human Services Committee. So I am running for re-election this year in November, general election, and hope that I would be re-elected so that I could serve another 4 years in the legislature.
Perfect. Thank you, Senator Arch. And again, we provided you, we'll just move now into the question just for the interest of time. But again, we provided you ahead of time with a set of 3 issues that's containing 4 questions, again, pertaining to the 50-plus in Nebraska. And looking again, 5 minutes for each question so we can stay within the time frame. Our first question this morning will be on health, caregiving, and home and community-based services. And Susan DeCamp's going to take that. So go ahead, Susan.
Good morning, Senator Arch.
Morning.
It's nice having you here with us. As you know, home and community-based services provide an array of services to people, help them with their daily activities in their lives, that promotes independence and allows them to age in place in their own homes and communities and delays them having to go into institutional care. Family caregivers also provide care for someone who is not able to live independently. These caregivers are family members, friends, or even acquaintances that often provide this service without any pay. And telehealth services can be significant for seniors, particularly in the rural areas or underserved communities. And they can also provide support to family caregivers by reducing their travel time, wait times, and costs associated with caregiving. So along those lines, we have 2 questions for you. What will you do to support the 250 unpaid family caregivers in Nebraska through policies such as enhanced respite services, access to telehealth, caregiver education and training, and help with out-of-pocket expenses? And the second question, what will you do to protect and/or expand the home and community-based services program, particularly in the area of recruitment and retention of a sufficient workforce and adequate funding of the services that Nebraskans and their families rely on?
Wow. Those are big questions. Okay, let me start with the first one, and I want to talk about telehealth because it was in 2020 that we saw that explosion of telehealth in our state. I saw it. I heard it from insurance companies. I heard it from healthcare providers that people do not want to go in to see the physician. They want to have that access at home and elsewhere where telehealth can be provided. So I introduced LR 350 at that point, and to do a study on telehealth. So I surveyed providers, I surveyed the insurance companies, I surveyed Department of Health and Human Services, what really is happening with telehealth in the state. And in particular, my question was, we knew that we were waiving a number of regulations because of the pandemic. Which of those do we want to continue when the pandemic ends? Which of those do we want to keep in place, because it opened up a lot of opportunity for telehealth? So we did LR 350 that summer and learned a lot. One of the things that we learned was, obviously there was just like, I don't know how many 1,000% increase in telehealth visits that was happening. But at that point, there was more than 50% of those were behavioral health visits. And my understanding is that that percentage may have actually increased. I haven't done a recent study on that, but just anecdotally, I've heard from providers that while telehealth exploded during that period of time for a large number of specialties, what's happening now is patients want to come back into the doctor's office for those specialties, but behavioral health is something different. And behavioral health worked well. You can be sitting across the room from a provider in behavioral health, or you can be sitting on a screen with a provider in behavioral health. And so it worked well for behavioral health. Both the patients as well as the providers wanted that to continue. So my understanding is that that percentage may actually be higher now, where patients have gone back to the offices for specialty care. They are continuing to use behavioral health heavily. So Medicare, Medicaid, private insurance all handle a little bit differently. So I introduced LB 400 then in 2021, which had three components to LB 400. One was it allowed for audio only for behavioral health services to an established patient. That was a large issue because we know that in some rural areas, broadband is not fully developed and not always dependable. And so the audio only was very important for behavioral health patients, for an established patient. And so for the provider that wanted to use that option was available for audio only. We also waived the requirement for a consent on a first visit. If you're in an emergency, particularly for behavioral health, you need to access that. But the third component, which I think was probably the most important of that particular bill, was the originating site. So it allowed for patients to stay in their home. And that was very important. Prior to that, in my experience at Boys Town Hospital, was the patient would have to drive to a hospital, to a clinic where there was already a physician available, present, or it was the originating site had to be in a clinic or a hospital. Now it can be in a home, and this was for private insurance as well as and Medicaid allows for that as well. So that was LB 400, and then LB 487 was the other one, and that requires private insurance to reimburse for behavioral health services at the same rate as in person. That incents the provider to do in-home and telehealth and allows that patient to stay. So telehealth was very important to me, and that was one thing that we were able to accomplish in the pandemic. Now I understand Medicare and Medicaid are still wrestling with some of those things that they want to keep, but we at least got that through at the state level at that time. So moving on to HCBS. I am more familiar with HCBS as it relates to developmental disabilities. We had a bill this last year that expanded HCBS services for children with developmental disabilities, but I fully understand how important it is to maintain people in their home. That is the best for most people, Some people need that institutional or a higher level of care, but for most people, if it can be done, it seems to work well. Workforce, without a doubt, is our number one issue. And I don't care what industry you're talking to, everybody needs more well-trained employees to support their industry. And I know that this is obviously an issue in healthcare, in home-based services, and all of that. So we've done a lot of things on workforce development, scholarships, community colleges, apprenticeships, high school academies, trying to get into junior high and high school and make sure that the students understand the opportunities to go into healthcare and really all of the businesses, just to make sure that they understand what those opportunities are. So we did a lot of that with the general budget this past year, as well as the ARPA funds. So I think that there's no silver bullet. We need to attract and retain. And I think that there's a lot of work being done in the legislature to do that.
Great. Thank you, Senator, for your answers. And also thank you for sponsoring LB 400 and 487. Those were important pieces of legislation, and we did support those. So yeah. Thank you.
Thank you.
Thank you, Senator Arch. And I echo Susan's comments, and I also echo how important it is for people in our membership. Telehealth has been a saving grace, not only for the pandemic, but outside of that too. So we do appreciate your leadership and your work on that, and hope more is to come on that. Our second question now moves us more like into the institutional, the facility size setting, the nursing facility quality, and Danny DeLong is going to take that. Go ahead, Danny.
Good morning, Senator Arch. Good to see you again.
Good to see you.
I'm sure you're looking forward to a good session this next year, huh?
Yep.
Yeah. I'm going to talk about nursing facility quality, and I'm going to start. You'll be familiar with some of these figures, I'm sure. Over 20,000 Nebraskans require care in nursing facilities or assisted living communities. Staying in the home is no longer an option unfortunately, for many of those folks. Facilities have closed their doors, citing reimbursement challenges and staffing shortages. Nebraska will need an additional 4,700 more nursing assistants, LPNs and RNs by 2028 to meet Nebraskans' care needs. Everyone, regardless of where they reside, deserves to be treated with dignity and respect and to have access to quality medical care. Better staff to resident ratios, we believe, improve the overall quality of care and well-being of residents. Workforce recruitment, retention, and job satisfaction challenges are prevalent across long-term services, as you've mentioned earlier in your response to Susan's question. Causes of workforce challenges must be identified and implemented to respond to the growing need for high-quality care. Our question then is, what will you do to improve the quality of nursing facility care for Nebraska residents, including addressing the growing long-term care workforce crisis in the state, professional education and training, and accountable facility reimbursement?
Okay. So where to start? I think you're fully aware that nursing homes are facing some very strong headwinds and crosswinds, quite frankly. There are, depending upon where you are in the state, you are experiencing some different issues, but they're all experiencing some similar issues. And I go to the rural communities in particular, and some of the struggles to maintain the skilled nursing facilities in those communities close to the home of the families, where they can come and visit, and much better for the person. Declining populations in the area are putting a lot of stress on skilled nursing. Home care, HCBS, is while better for the patient, is also putting stress on skilled nursing facilities. And so fewer people are going into skilled nursing, or for shorter periods of time, which is good for the patient, but hard on the skilled nursing facilities. workforce shortages, in particular the nurses, the skilled therapists, the ones that are in short supply in the rural communities. That's putting a lot of pressure. And then wage inflation. Wage inflation is very real, and sometimes skilled nursing facilities are competing with hospitals for nurses and other caregivers, and then just availability of physicians and all of that. So a lot of pressures on skilled nursing facilities. One of the things that I worked with Senator Williams, I guess it was maybe 2 summers ago, where he gathered the providers and Department of Health and Human Services together. We had the conversations of redesigning the reimbursement formula for skilled nursing facilities. There was some disincentives and some lack of rationale on some of the way the dollars were being divided and the rates that some were being paid versus some of the other were being paid. That was successful, and frankly, I think sitting down in the room and having those conversations is probably a better way than passing a bill. But that was successful in redesigning that reimbursement formula, and that was helpful to them, I know. I've also supported expansion of nursing programs this past year. That was a big issue within the AARP dollars, the American Recovery Act. And so how those dollars were spent, we saw that there were people wanting to get into some of the nursing programs and not able to because of lack of funds, and we put some scholarship dollars into nursing, and that would impact hospitals, but it would also impact skilled nursing as well. And so those are some of the things that I've done, but I guess, overall as well, recognizing that skilled nursing is changing and the facilities are changing and adapting. Even yesterday, I was down in Lincoln, and I hosted a meeting with the Department of Health and Human Services, a hospital from Lincoln, and the Nebraska Healthcare Association to talk about one particular kind of difficulty we're having, which is the placement of I would say those who are suffering from either a psychiatric condition or dementia or some other disabling condition that makes it very difficult for skilled nursing facilities to admit. And they have a lot of regulations from Center for Medicare and Medicaid Services that make it difficult for them to admit. We were trying to discuss how to overcome some of those barriers and the best way, because I think the nursing facilities are willing to accept those types of patients that are in need of skilled nursing care, but they're going to need some relief as well. So it was as recent as yesterday that we were having those discussions for skilled nursing facilities.
Thank you, Senator. Appreciate your ongoing advocacy for people to stay in their home, and when people need to leave their home, that they can go to Nebraska facilities and find great care. Keep on pushing. Thank you.
Thank you, Senator Arch. And our final question for discussion today centers around livable communities and helping people stay in their home. And Tim Potter is going to take that one. So go ahead, Tim.
Okay, thank you. And thank you, Senator Arch, for being with us today. A livable community is safe and secure, offers affordable housing and transportation options that allow individuals to travel by multiple means, and provides supportive community features and services for people of all ages, allowing people to remain in their communities as they age. Affordable and reliable health care and transit options are critical to support older Nebraskans aging in place. High-speed internet should be affordable, reliable, and accessible for all Nebraskans. Digital skills development is also essential to obtaining the benefits of high-speed internet access in the home. And you've addressed some of these issues in your previous answers, but the specific question for livable communities is, what will you do to ensure all Nebraskans, mainly those 50 plus, have access to livable communities which offer affordable housing, diverse transportation options, adequate health care, and affordable reliable, and accessible high-speed internet, including digital skills development.
Okay, yeah, very important issues. Let me talk about a couple of those specifically. One has to do with high-speed internet, broadband. Everybody has recognized for many years the need for broadband coverage across our state, not only for being able to stay in the home, but actually being able to develop businesses and education, remote education, all of those things that would allow communities to maintain and grow their population and have good jobs, all of that, very necessary. So lots of money has been committed to broadband expansion. I think, yesterday I was having a conversation, somebody from the Transportation Telecommunications Committee, about what's next this next year. And I think we all understand that. I think the dollars have been committed, but now it's a question of coordination of the spending of those dollars. Where's the priority? How do we do that? There's different pots of money. There's different players involved in the expansion of broadband. And so I think that the biggest challenge is going to be the coordination and communication amongst all of these parties, and how do we set it up so that there's the leadership to coordinate that. So broadband is a big issue, but I think for the first time there's a lot of money, but now it needs to be spent well. And so that's one thing that we'll see next year, I'm sure, particularly in the Transportation Telecommunications Committee. Adequate health care. Critical access hospitals in the rural areas have been obviously very important to maintaining a level of service availability to the community. But even some of the critical access hospitals now are struggling with the requirements from some of the other federal regulations regarding that. And so this past year, we passed a bill that created another category of hospital licensure, getting ready for the Centers for Medicare and Medicaid Services to allow what really is a step down from a critical access hospital to more of an emergency level hospital, where that would be 24/7 available to the community, but the patient would come in, be stabilized and transfer, which wouldn't require inpatient beds on the property and to maintain those, because again, the struggle with workforce and the staffing of those, all of that is a real issue in some of those critical access hospitals. So that was at least a step we could take in making sure that adequate health care is available in those communities, certainly for an emergency situation where they would be able to do that, versus simply closing the critical access hospital because they weren't able to survive with the volume and the reimbursement. So I say, that's part of that. And of course, we talked about workforce, no easy solution, but we'll keep working on that. And some of the AARP dollars that were committed are just going to start to roll out. And we hope that we'll see those playing out in probably 3-4 years, where people will be able to go through their education process and get licensed and be able to come out into the communities, because we know that's absolutely critical.
Okay, thank you for your response to that.
Thank you, Senator Arch. As we're coming now to the end of our 30 minutes in our meeting here, I'd like to offer back to you the final minutes for any closing comments, thoughts, anything you have as a messaging for our members and the constituents of your district. So you've got a good 5 minutes. If you want to take it, go ahead.
The one issue that we didn't talk about is taxes, and I don't care where you are in life, taxes is an issue, and particularly property taxes, but more than that. And so some of the things that we did do in the last 2 years in the legislature, we eliminated the Nebraska tax on military retirement benefits. That is a benefit to my district, no question about that. We're in process of phasing out the Nebraska tax on Social Security benefits. That's in process now. We reduced the inheritance tax. and hopefully we can come back and do more of that next year. So over $1 billion in tax reductions this last session we put into place. You're going to see more of that in this next session. Obviously, the rainy day fund is now at 1.3 billion approximately, and so there's opportunity to do more of the tax reductions for the state, and that's obviously a benefit for anybody on fixed income and retirement. So that'll continue. The other piece of tax information is, and this interview is timely because I believe tonight and tomorrow night, Wednesday and Thursday of this week, the transparency hearings for the first year are going to be held. So every county and every taxing authority within the county needs, if they exceed the formula, they need to go to these meetings and present to the public. So if this message gets out, that is something to stay in touch with. We all got cards. We all saw what our increases are going to be. We all blanched at what those increases look like. But the transparency is very important. So I would encourage people to attend, and this will be an ongoing each year. And there'll probably be some tweaking to make it clearer and more understandable when those cards go out. So tax reduction is probably the other piece that I want to mention, and you'll hear more about that in this next session.
Great. Thank you, Senator Arch. And I do want to publicly thank you for, especially on the Social Security tax exemption bill that's been worked on for many, many years. And we do appreciate your leadership and thank you for your vote in passing that. That will actually help a lot of our members and a lot of Nebraskans across the state. So thank you again for your leadership.
Yeah.
We are now coming to the end, Senator. So I want to again thank you for taking the time to visit with us. We wish you the best with your campaign. And thank you again, most importantly, for meeting with AARP today. Take care.
Thanks for the opportunity.
Absolutely.
Have a good day.
Senator Arch.
Thanks, Senator.
Thank you.
Good to
Bye.
see you.